Right now, we have 53 participants, which is wonderful. We do expect to have close to 80 people on board today for the launch of our Get in the Hearing Loop campaign. So I'd like to welcome everybody and say thank you for coming. I'm going to get started because we did say we were going to start at 1 o'clock, and that's what time it is. So we'll get started. So good afternoon, everyone. I'm Lee Pigeot. I'm the National Executive Director for the Canadian Hard of Hearing Association. And I want to welcome all of our guests, our panelists and participants from all over Canada and also into the United Kingdom. So we're really excited today about this launch of our campaign. And on a personal note, I want to say a specific thank you to our staff team here at CHHA National. Richard, Gordana, Carla, you've done an amazing job to get this started. And I just want to make sure that I say thank you to you on that. And also to our networks across the country who've really been leading the way. Sudbury, Edmonton, Hamilton, and the others who've inspired us to expand this program, the things that you're doing in our regional areas across Canada. So thank you for being our inspiration on this. And also to Stephanie and Mark from HATS Group for their continuing really hard work on this project, and also for installing the very first hearing loop in our office at our reception desk last week. So we're walking the talk as well. And of course, Juliëtte and everybody else who's going to be on board will be sending a little bit more detailed information about you guys in a bit, but I wanted to say thank you. So right now, I'd like to introduce to you Gilles Levasseur. He is the CHHA National's new chair of the board and our president, and I'm going to invite him to say a few words. So Gilles?
Well, thank you, Lee, for the kind words. It's always a pleasure to be part of this type of environment that we see people committing so strongly to the well-being of our colleagues. And I'd like to take this moment to thank you for attending. It sounds simple to say that, but that's what makes our success. And we want to make sure that we welcome all the participants, the panelists, the speakers, on behalf of the Canadian Hard of Hearing Association. For us, it's a commitment to the people, and that's what we see when people participate. Now, one of the key things that we'd like to mention is that this project that we're launching today, it's part of the whole vision that CHHA has actually been developing over a certain time. So it's part of our desire to see the hearing loss community achieve a quality of life they desire. That is our key thing, to enhance the quality of life of those who have a certain limitations. And that's where we want to move ahead as this organization and with our partners. And one of the partners that is interesting to pinpoint is the actual CHHA networks. They have done a tremendous work with our communities. And the key thing is, over the years, okay, we've been actually working these type of projects, but they have been developing this looping project in key areas and have inspired us to launch this program at a national level. So we want to make sure we say thank you to CHHA Networks. Great job. You guys are good, and it's fantastic what we're doing today. But then brings us to two final things that I'd like to bring to your attention. The first one is CHHA National is supporting initiatives such as this campaign to bring more attention on providing accessible communication access for people who have hard of hearing issues. Our goal is to connect and educate as many businesses, organizations, to include the installation of hearing loops. So it's nice to see that we have this great project, and our goal now is to increase corporate sponsors to support the cause. So this is where we're going as an organization. So great job, excellent. And the last thing I'd like to say is, as a conclusion, let's get looped Canada. This is where we want to go, and thanks to you, we'll get there. Lee, I give you back the floor.
Thank you, Gilles. What I'd like to do now is I'd like to introduce to you Dr. Juliëtte Sterkens. Dutch-born audiologist Juliëtte has more than 40 years experience in the field of audiology and hearing rehabilitation. She is on her encore career as a consumer and hearing loop advocate for the American Hearing Loss Association and frequently lectures to consumers and hearing professionals around the world. Her efforts have led to 825 hearing loops in Wisconsin alone, including 450 churches, 35 theaters, and thousands of loops around the country. For these efforts, she's received numerous awards, including the Wisconsin Audiologist of the Year and the American Academy of Audiology Presidential Award. She's a member of the HLAA's Get in the Hearing Loop National Task Force and the Wisconsin State HLLA Board. She serves on the board of the Hear in the Fox Cities, which is a nonprofit that helps pay for hearing aids for children and teens in Northeast Wisconsin. So I'm going to turn the floor over to Dr. Sterkens. So thank you.
And Lee, thank you very much for inviting me. I've been actively involved with HLAA since about 2009, when I discovered that hearing loops would make a huge difference for my patients. And initially, I just wanted to loop Oshkosh, Wisconsin. That's where I'm located, and that's where my patients report that they had trouble hearing. But I got more and more involved with HLAA, and in 2012, I quote unquote retired from my practice to take on the looping in the United States. And in this capacity, of course, I work with consumers, I work with professionals, I work with ministers, frankly, anybody who will listen to me, right? And it turns out that it's not just people who have trouble hearing, it's also the people who live with people who have trouble hearing, or even normal hearing people who get it. And a hearing loop, in its simplest format, a hearing loop wirelessly broadcasts audio from a stage, from a pulpit, or a television, wirelessly direct to the telecoil in a hearing aid. And as such, the loop provides direct connection from the microphone, this microphone that's right at my mouth, to the hearing aid that the user, or the cochlear implant that the user has on their ear. Hearing loops can work in small places, ticket booths, taxi cabs. They work through glass and plexiglass, but they also work in very large venues like theaters and mega churches. And the question then becomes, well, why do people need hearing loops, right? If they already own hearing aids, or if they already own cochlear implants. Well, the truth is, while hearing devices have greatly improved in the last couple of decades, they don't give people normal hearing. Hearing devices have limitations, and think of walking into a big church where there is a lot of reverberation, or even just in a meeting room. People with hearing aids are very sensitive to that type of reverberation, and hearing loops help overcome those limitations. Think of hearing loops as ramps for people in wheelchairs. So why do people with hearing aids and cochlear implants love loops? Because it gets them direct access to sound, no background noise, no reverberation, just clear sound. It is as if their ear is only inches away from the mouth of the speaker. And Dr. Myers, who sponsors a lot of my outreach in the United States, has likened hearing in a loop to going from a gravel road to new, smooth asphalt. You can sit back, you can hear with ease, and you can process that information so much better. So in the United States, we have the Get in the Hearing Loop program, or GITL for short. So pretty soon you'll all start talking in the term GITL. And we are working to educate HLAA members. Many members already, of course, know about loops. They use loops at their chapter meetings. They have used hearing loops at their national convention. But we're also working to educate hearing professionals so that they fit hearing aids with T-coils and educate consumers who are coming into their offices to buy hearing aids. So, but we quickly realized that if you don't give advocates, if you don't give consumers who are willing to advocate good tools in their hands, nothing happens. So the GIDL committee, the Get in the Hearing Loop committee, has developed a pretty comprehensive toolkit. And I know that CHHA is going to be working to adapt those materials for the Canadian market. And of course, it's fantastic that Canada is going to join hand with HLAA to make this happen in Canada, because it can only help raise even more awareness. People travel. And so how did we get hearing loops installed, right? Because there's barriers. And, you know, I already mentioned earlier, loops can be used in a variety of situations, but those places, they don't know that people who have hearing loss or wear hearing aids can't hear unless you as a consumer talk about it. And so, yes, some of the onus is on you. You need to literally help spread the word that you have trouble hearing. Don't stop attending. Hand information to the venue that you have trouble hearing, but that there is a way that this particular venue can be made more accessible. So I think what HLA members have done very well is to educate what are called PIPs in their community, people of power, people in City Hall, people in the ministry, librarians, people who run businesses that are dealing with perhaps an aging public. Also, HLAA members have worked to change laws in different states, laws to mandate education about telecoils, laws to mandate the installation of hearing loops. And of course, places need to hear this from the very people who live with hearing loss every day, and that's you. So if you're watching this webinar and you're wondering, but I want to read a little bit more, well, I'm here to tell you that the toolkit is on HLAA's website, and I'm hoping there will be a link on CHHA's website. But for now, it is hearingloss.org/GITL, GITHL. And like I said, the kit includes brochures, information for certain venues, and together, and of course, I'm also hoping that some of these materials will be translated en français so that the Francophone members from CHHA will be able to read this in their native language. For now, if you're watching this webinar, it's important to find out if your hearing aids have a T-coil and whether the T-coil has been activated. If you're a cochlear implant user, good news, all behind the ear processors have the T-coil built in. If you use a hearing aid, many hearing aids have the T-coil built in, but it may not have been activated by your provider. If you are a hearing aid user and you connect your hearing aids to Bluetooth on your cell phone, or you have a TV streamer, or you use one of those remote microphones, there's a pretty good chance that your hearing aid also has T-coils built in. And we have a handout that says, ask your audiologist. You can print that handout off, take it to your audiologist and say, I want my telecoil activated. And just a quick suggestion on my part, while you're in his or her office, in your audiologist's office, never go and see your audiologist empty-handed. If you don't know what to bring your audiologist, contact me. I will send you a PDF of handouts that are meant to educate professionals about the benefits of telecoils and hearing loops in the community. If your provider told you that you must choose between Bluetooth and telecoils, there is good news. I think you can have your cake and eat it too. All manufacturers offer hearing aids that include Bluetooth and telecoils. Bluetooth is not going to replace telecoils anytime soon. We're simply not there yet. You may read news releases that there is a new technology called Auracast available. And yes, it will help you hear better on the phone and your TV and your laptop, but it will not surpass the benefits of having a telecoil in your hearing aids for public assistive listening. So in the meantime, make sure that your hearing aids include both, and tell anybody who is shopping for hearing aids that they need to consider having both technologies in their hearing aids. If you're wondering where you can try hearing loops, I understand CHHA will soon be posting a list of hearing loops all around Canada. If you travel to the United States, there's a website called time2loopamerica.com, where all known hearing loops are listed. And the biggest news of all, the GIDL committee is working with Google Maps to put hearing loops on the map. And I'm going to be talking about that more in an upcoming webinar for CHHA. For the truth is, for progress to occur, we don't need just a handful of advocates doing advocacy perfectly. We need every single CHHA member doing a little bit, the little bit that they can to advocate for hearing loops, even if their advocacy is imperfectly. I've known of loops happening where the advocacy started 5, 7, or 10 years ago. My goal is to find hearing loops wherever I go, wherever I travel, and I'm going to help you make that happen in Canada. My email address is jsterkens@hearingloss.org, and you are welcome to email me. Thank you so much, Lee, for inviting me to speak and make me your honorary Canadian CHHA member. I'm excited to have 2 memberships, one for the US and one for Canada.
You're most welcome, Juliëtte, and we'd be glad to have you anytime to talk about our hearing loops. I wanted to say thank you specifically to the Hearing Loss Association of America and all the work that you're doing with us. Juliëtte and her team have done so much to get us started in this campaign. The rollout with Google, the rollout with our list are all coming because of the great work you've been doing. And so we're really glad to be a part of what you've been doing. So thank you very, very much. Now I'm going to be turning the program over to Stephanie from our HATS group, but I just wanted to make sure that everybody understands what we're trying to do here. Today, we're launching our program that's going to drive awareness and create a national movement of loop enthusiasts to promote this communication access across the country. This is just the beginning, because we want to remove those communication barriers and build inclusive spaces for everyone, especially the hard of hearing community, by installing these loop technologies wherever possible. So thank you for being a part of that. But that's really what we're trying to do. Now, we do have this program, and I'm going to turn it over to Stephanie right now. And Stephanie Brown is the managing partner with Mark Gagnon of the HAT group. And they're going to talk a little bit about all of the things that we're doing, including our new website for Get in the Hearing Loop, that's going to have all of the great things that Juliëtte was talking about, to be able to speak to your audiologists and to be able to speak to retail locations, churches, banks, libraries, anywhere where we will be able to put in this technology. Thank you.
Thank you so much, Lee, and good afternoon, everyone. We're so pleased that you were all able to join us today. And of course, I'd really like to take the time to acknowledge Dr. Sterkens for joining us today. As Lee mentioned, my partner and I, Mark Gagnon, are managing partners of the Hearing Assistive Technology Group, otherwise known as the HAT Group. And we had the pleasure of traveling to Michigan in December of 2021 and spending some amazing quality time with both Juliëtte and Dr. David Myers. And to say that they inspired us is an understatement. The power that these two individuals have brought to the hearing loop community and to help those that are hard of hearing is undoubtedly one of the most inspirational things that I've experienced in my career. And I just want to take some time to acknowledge that, because Juliëtte specifically has really been a driving force in helping us to stay on track with our main mandate to help others. And she's been an incredible resource in really helping us understand how the hearing aid and the telecoil and the loops all work together. So once again, Juliëtte, thank you so much for being an honorary member of CHHA and for being so important to this mission, and also for inspiring us to really push for this campaign to be launched within Canada. So I also wanted to take some time to mention as well that we did build a custom website dedicated to this campaign, which is www.getinthehearingloop.ca. And certainly the piece that was taken from the HLAA website dedicated to the same campaign name really is what inspired this website to be launched. And as Juliëtte mentioned, there's a tremendous toolkit and resources available on the HLAA website that we then obtain permission to replicate and to Canadianize. So those documents are available on the website and can be downloaded. So I'd invite everyone on the call today to please visit the website. If you have any feedback or any questions, please do not hesitate to send an email to loops@chha.ca, which is a dedicated email for this campaign. And again, we're so very excited to have become the technology partner for CHHA with respect to this campaign specifically. And we're also very excited to, really bring this awareness to not only Canada, but to also welcome other technology partners that are also doing what Mark and I do, which is to help people hear properly in public spaces. So I know there's likely some other partners on the call today, and please understand that we are, really wanting to make this a mission for everyone to benefit. So we welcome, anyone that's on the call that also has the same mandate or is doing the same work that Mark and I are through the HAT group. And as this evolves, as the campaign continues to grow, we will be adding additional resources. We will be putting additional information with respect to areas of Canada that are looped. And we will continue to also develop additional resources that will be leveraged through the website, and including videos, case studies, and any other pertaining or information that's pertaining to the campaign that we think will be beneficial. So again, everyone on the call today, your participation and contribution towards this campaign is so important to us. And I just again want to thank you all for joining today. Thanks.
Thank you, Stephanie. That was great. We're really privileged to have Stephanie and Mark as our partners, our technology partners. We had spoken briefly at the beginning of this about those organizations, those networks that have inspired us. And I'd like to introduce to you Cindy Gordon from our network in Edmonton. And Cindy is the program director for CHHA Edmonton, and she's going to say a little bit about the great work that's being done out in Northern Alberta for our Hearing Loops campaign.
Thank you, Lee, for allowing me a few minutes to speak out on hearing loops and what is happening in Edmonton. And I'm really honored to follow our looping goddess and mentor, Juliëtte. It was actually after her speech in Edmonton in 2017 about loops that we decided that this was going to be our pet project here in Edmonton. We were lucky to have our president, Lee Ramsdale, who is as compassionate as Juliëtte about loops, but also he's educated on the installment of loops in our midst. So he spent numerous volunteer hours doing assessments and installs for us here in Edmonton, while I focus on the education, the promotion, and the connections. The past few years, we have made this a profit-making enterprise in Edmonton to help sustain our branch. To date, we are proud of working directly with, as Juliëtte says, the people in power and the influence, the city of Edmonton. That's where we began this mission. We thought if we did something with the city, that people would follow suit, and that is what has happened. So we have looped the entire city hall, 17 of the Edmonton paid kiosks, all 22 of their recreation centers, 20 libraries, and the senior centers that are owned by the city as well. We've looped many other senior centers, churches across Alberta, 4 theaters here in Edmonton, 4 banks, just recently 2 grocery stores. And we have also done an RCMP building and personal homes. We can't forget that some people actually like to use these right in their own locations. We've done 10 separate locations in a suburb of Edmonton called St. Albert. And recently, our building code has been changed to promote that all new medical facilities must also be looped. So we're heading out there tomorrow for our first medical facility. We've surpassed our 100 loop mark here in Edmonton, and our goal is to continue to promote the use of loops and all barrier-free communication access. We're really happy to be part of the solution and look forward to working with National on furthering this initiative.
Great. Thank you very much, Cindy. Really appreciate that. Next, I'd like to invite Levi Genosi from our CHHA Hamilton branch to speak a little bit about some of the work that they've been doing specifically with the city of Hamilton and all of their new build bylaws. So, Levi, thank you.
Thank you, Lee. And I have to start with echoing Cindy's and your welcome to Dr. Sterkens for joining us in this initiative. And thank you to National and everybody who's on the call to actually promote this undertaking, because it is a huge undertaking. And that's what I wanted to talk about a little bit. We, back in 2017, approached the city and the councilors and displayed a young lady who had a cochlear implant and made it our guest speaker to promote the passing of a resolution, which eventually got passed at the city of Hamilton with full acceptance, no nays, totally. And as a result of that initiative, a number of locations were directly looped. The Bernie Morelli Center was looped. The Sackville Senior Center was looped in Hamilton, and that's directly related to this initiative. And just a quick note on the 26th of this month, because of COVID, we could not actually test out the facility, but we usually have a cochlear implant meeting. And on the 26th of this month, we are actually gonna be in the looped facility for our members to come and actually join that event. and hopefully hear everything. Just a very quick note. I got introduced to the loop system back in 2002-ish, and I went to a conference, and the first time ever I could actually hear everything that was said, and I was absolutely blown away. And I have to echo the words of Dr. Sterkens. I think it has to be us pushing everybody, because people just don't know. Education and advocacy is the two key elements, and that is why this event is going to be so important, to make sure, not that we do it perfectly, but we just do it, get the word out there, because it's important. It's important. If it's important for somebody to hear it, for me, for somebody to say it, it is absolutely important for me to hear it. And that is whether we are in a big church or we are in a small room. So finally, I just wanted to mention one thing, and it's so dear to my heart, and I have to say a shout out to all the volunteers in Hamilton and our board, because we are 100% volunteer branch of CHHA, and I just want to say a shout out to them for all the hard work. But we put on an event with one of the manufacturers, and we invited the room where we usually have our events was actually looped for that event. And the reason I said each individual matters, because at the end of the event, there was a couple that came up to me, and they were from Niagara Falls. They came up for this event to Hamilton, and the gentleman says, I didn't have to look at the captioning. I didn't have to do anything, and I heard everything that was said. Thank you very much. And you know what? At that time, I would basically just put a check mark over there. That's why I'm doing this. So I just want to thank you again, all of you, for being here. We're going to keep on plugging away one loop at a time, and make sure that people can hear us. Thank you.
Thank you, Levi. I really appreciate all the work you're doing, especially in regards to working with the legislation, the local legislation, the municipalities. They're the ones who are going to make the quickest, most impactful difference as we get this started. And just to start on that, I'm going to give you an example. We've heard from a lot of the internal people, the people who are promoting this, but there are a lot of organizations and individuals who are doing some great work with us. And I'd like to introduce to you Mandy Kerr. Mandy is the Supervisor of Recreation and Adult Programs in the Department of Recreation and Community and Culture in Burlington, Ontario. So Mandy works in municipal recreation, and in this role, she works towards creating a healthy community by providing a wide array of recreational programs based on the wellness wheel spectrum that feeds the needs, the hands, and the hearts and mind of individuals. They also address the key dimensions of resilient community health. Her focus is on designing programs that create strong social connections for Burlington's adult and older adult communities, and building relationships to support these groups who wish to do the same. With more than 700 programs in sport, fitness, wellness, and creativity of all kinds, social and personal development, continual learning activities, her recreation team provides an amazing array of programs throughout the city. These meet the diverse interests of the entire adult community. She believes that access to recreation is a right and celebrates the individual's uniqueness and works to reduce the barriers wherever possible. And she welcomes the opportunities for fun and friendship. And the City of Burlington staff are committed to hearing loop installation, and their recent installation and the impact on the community is well felt. And I would like to introduce to you Mandy Kerr.
Thanks so much, Lee. What a pleasure to be here. It's so inspiring to hear from you all. And I guess I'm here just to talk a little bit about our recent installation and the process and give you my perspective on how things went. The City of Burlington has a commitment to creating enabling environments and inclusive programs, as Lee was saying. And we understand that, like many, we have a lot of work to do in this area, but we are continually looking to improve our best practices in the areas of inclusivity and diversity. For our staff team, we see diversity as the measure of our inclusive practices. If we design activities that draw diverse individuals and groups and create communications that reach people in a way that work for them, if we recruit staff that reflect the vibrant differences of our community and create spaces where people feel welcome and respected, then we feel we are planting the seed well for inclusion to happen. As part of the Burlington Active Aging Plan, which was really a roadmap for inclusive communities and age-friendly communities, we conducted extensive engagement with our community and knew that we could do much better in reducing barriers to participation in community life and recreation access. We scoped a plan to address the needs in one of our centers that sees the greatest need for accommodation. So we focused on making the Burlington Senior Center a place that was easier to move through and easier to interact within, where communication was seen as a right, and that we could not only do better, but we are responsible for absolutely investing in technology that would enable those who are hard of hearing to participate more freely and confidently, simply because they could begin to hear better. We focused the project on improvements in our busiest community rooms and reception spaces. And we also understood that the bustle of background noise, counter separation, and detailed information sharing, some of which was private in nature, made customer service desks important places for community members to be able to hear more clearly. With this in mind, we expanded the project to 5 of our busiest service desks in various community centers and to 6 community rooms within the Burlington Senior Center. In total, this installation saw multiple service bays at customer service desks throughout the city and 9 hearing looped zones within the Burlington Senior Center. We also applied for the Ministry of Seniors and Accessibility Inclusive Communities grant and were successful in obtaining $58,000 towards this project. And we earmarked a 16-month window for the project. And we probably would have hit that bang on if it wasn't for a small little interruption called COVID, which slowed down a few things in a few areas for us. As a municipality, our procurement of services process is very fair. It's transparent, and quite honestly, it can be a lot slower than other organizations at times. This involved the procurement process, that is, involved inviting estimates for services and in some cases, meeting with potential vendors to explain in detail our needs. It also required a tour of the facilities with potential vendors. We reviewed and assigned the project to the successful vendor, which to our complete satisfaction was the HAT group, Mark and Stephanie, to name them specifically. Their desire to configure the equipment to our end users' needs was outstanding and set them apart. Our project team was complete at this stage, and it was made of, if you look at the little circles over there, representatives from all areas who would be using the equipment. It was supported by council members, and technical expertise was provided by HAT and our internal IT representatives as well. And those two groups spoke the same language. And I'll just mention that both Mark and Stephanie are fully fluent in interpreting and translating non-techie lay people like myself and my language, and skillfully arriving at solutions based on the information that I provided. Our biggest next step, which is underway still now, is rolling out training to all of our program staff working in hearing loop enabled spaces. and then offering daily educational materials and one-on-one demonstration to our customers. We really like the one-on-one approach to informing people about the use of these. It gives us a chance to build relationships with our community and provides a really dignified and respectful way of having open conversations about hearing loss and living with it most effectively. One of our fundamental principles is to ensure that all of our staff see wearing or using the headsets and mics as just one part of their daily uniforms. We felt it was imperative that service was as seamless as possible. It was non-intrusive. It didn't separate out users from non-users, and that it becomes not only normalized, but a new service level that is reprehensible if not provided. So that's our principle going into this. In our recent launch information session, we were able to witness the profound difference that technology such as this made to several of the people who use the technology for the first time. And it was inspiring. In some ways, it was disappointing that we didn't get on it sooner. And we can't wait to see more and more people feel more welcomed, more involved, more confident, and more connected as we expand this program over the summer and continue it on, hopefully, into all public spaces. We fully expect that we'll be making small improvements as we move forward, and we also fully expect that we'll continue to strive for access, equal access, barrier-reduced access in all of these public spaces. I provided a little bit of information on the slide. Thank you, Mark, for showing it. And I'm happy to answer any questions at all about our experience if there's an opportunity later, or you can reach out to me at any time also. Thanks so much for letting me talk a little bit about our experience.
Thank you very much, Mandy. Very glad that Burlington has made such an effort to be in the loop even before we had that going. My next presenter is Kim Scott. Kim is the Executive Director of the CHHA Sudbury Network, and she is an amazing advocate for hearing loops and has really led the way to working with grocery stores and with working in the retail space. And I'd like to welcome her right now. Kim?
Thank you, Lee. I'm really excited with this launch of this wonderful campaign, Get in the Hearing Loop in Canada. And I'm very, very excited that Juliëtte Sterkens has agreed to become a primary spokesperson for us. It's wonderful to see her wonderful face again, Juliëtte. In 2018, the Canadian Hard of Hearing Association Sudbury launched our campaign that we called at the time and still do, Hear the North. And the effort was to make places, public places and private businesses and so on, accessible to people with hearing loss and barrier-free. In 2018, we launched the campaign with bringing Dr. Juliëtte Sterkens here to Sudbury to visit us along with her wonderful husband, Maxwell. And we've also launched the campaign officially by gifting the Sudbury Theatre Centre a loop system. And it went off very well. And then as we went into 2019, we had a number of local churches that had looping installed. And we also initiated and launched a campaign, the Hear the North Fund, which would provide financial assistance to various organizations looking to make their facility hearing accessible. And one of the first big applicants was the newly constructed Place des Arts, which is just had its grand opening on April 29th. And it is the first and only fully looped French Performing Arts Center in Canada. And it has looping not only in the theater and on the balcony, but also in the rehearsal and dressing rooms and multi-purpose room, the ticket booths, the bistro and the table seating area, as well as the boardroom. So it was quite an undertaking, and we're very thankful to Regency Sound for undertaking that installation. And but then we were kind of slowed down a bit because the pandemic hit, as it did with everybody. And into 2020, we were stalled a little bit, but in 2021, we came roaring back with the plan of trying to help people with their hearing loss cope through the pandemic. And what we did is turned our attention to places that people were going to every day, such as retail outlets. And we approached the Loblaws chain, your independent grocers, and Real Canadian Superstore, as well as Giant Tiger stores. It's been met with great success. In the Sudbury area alone, we installed over 70 counter loops last year throughout these stores, not only at the checkout caches, but also at the if anywhere you have to communicate with somebody in a location like that. So at the butcher counter, at the deli counter, the hot food, the pharmacy, pickup, drop off, every point of where you're communicating with somebody. Some of these stores have as many as 20 counter loops in them. And when we did the installs, we really went along with the motto of CHHA, which is our efforts to make the invisible visible. And we decided that we really needed to focus as well on educating the public. We had these incredible, they're very successfully and well received floor decals made that indicate for people to stand here when the loop is installed. So it makes them very visible and that there's something here to help them. Everywhere there is a loop, we also have leaflets made available for people and brochure holders. And it's a leaflet that any customer could take with instructions on what the T-coil is and the hearing loop and how it works, and to go to their hearing health provider. We had decided before we launched the campaign, one major hurdle that we had to overcome was to how to get people to have their T-coils activated, or indeed even have one within their hearing aids. We have been working for many years on trying to work with the hearing health industry with little success in terms of advocating for the T-coil and its benefits. So we decided to switch our attention to educating the general public. So in that, we've been very successful, along with being very visible wherever there's looping installed. We also created public service announcements that are playing on CTV. They're about an average of about 20 ads a week running year round, educating people about the T-coil, that it will help them hear better in public places. And if they visit their hearing health professional about and request the T-coil, then they too can have the opportunity to enjoy better hearing. So I really am excited. We are going forward. We also have done, we're going to Sault Ste. Marie this year. We were just there a couple of weeks ago. They are thrilled. We have one church already that has a loop installed. Another one is in the works. We also have the independent grocers in Sault Ste. Marie and the Giant Tiger. And since our visit 2 weeks ago, we've received 2 inquiries from the White Pines Theatre Center as well as the Algoma Conservatory, who both want to become looped. People are excited. They want their lives back. They want to be included. They want to be a part of everybody else's life. And when they know that this opportunity that was once a dream is tangible, that they might be able to experience this, they are coming out in droves. The public service announcements in the Sudbury area, we now find about 35% of people with hearing aids have their T-coils activated. People are going into their local audiologists, 2 to 5 patients every day, asking about the T-coil. So prior to our campaign, only about 2% of people in the Sudbury area have had T-coils activation. And in less than a year, we've gone up to over 35%. That's a wonderful jump, and we're going to continue to work at it. So we're thrilled to work with the national, we're thrilled to work with other branches. And one final note is that I just found out this week is that the Real Canadian Superstore, the chain is looking at doing installations of looping across Canada at all of their stores. Loblaws is looking at some other pilot locations as well across Canada. I want to extend my gratitude to Cindy Gordon and Lee Ramstill with the Edmonton branch when we approached them last year to partner with us and do a looping installation, and we provided the equipment to enable them to do so. And they have just taken that ball and run with it. And so we're thrilled. And I'm excited what this means for Canadians with hearing loss. So I want to wrap up with one final message to everybody in all public places and all retail and businesses. It makes good sound sense to invest in making your facility accessible to people with hearing loss, because we represent more than 10% of all Canadians. That's millions of Canadians are living with hearing loss every day. And if you loop it, we will come.
Thank you, Kim. I really appreciate all of the great examples that you're talking about, and that Sudbury has really led the way to Northern Ontario, in the retail sector, especially in the grocery area. And it is because of the work that Sudbury is doing that the Real Canadian Superstore will be working with us to loop all across Canada, and hopefully we'll be able to move more and more across there. Now, we've had a lot of questions across our work here, and I'm just going to share my screen. I'm going to share the Get in the Hearing Loops website that's up. And as you can see here, we have the email address where you can email any of your questions that are very specific or detailed. We have our 1-800 number, and specifically, someone was asking about the resources. We do have the Canadian version of all of these PDFs and information that you can share and you can take to your audiologist, up and ready to go. We've launched that as of about 15 minutes ago. So that's all up and ready to go. So thank you very much for our team for bringing that up to us. We do have information about the T-coils and about the hearing loops, and this is just the beginning of all of the great work we're going to be able to do. Now I'm going to answer a few questions people had. Most of them can be answered by going to our website, and you can see some of the work. There was a question regarding hospitals. Right now, hospitals have not been our focus, although for those in Eastern Ontario, the Ottawa Hospital, which is building a new mega hospital, has invited CHHA to be a part of their accessibility team for the design. We'll get some consultation, so that's great. We are working with many of our industry partners to speak across the medical associations to get going on this. Other questions we have, looking here, we have questions about the hospitals that were there a couple of times, so thank you very much. Yes, we will have the ability to get some of the more larger promotional materials ready to go. And for those who are wondering, how we're going to be promoting this, this is our launch. We are working towards working with consumers, getting the installs, and what we're trying to do is to work with people like Kim and with specific retailers, because we know that with public service announcements, and we work through the consumer base, the more people who have access to the loops, the more we can specifically work with our industry associations. And CHHA National does sit on many committees where this is going to be a promotional project. So they also have a question about representing this at the Canadian Audiology Conference this fall. I can't speak for them. We have spoken to them, so that's not a question I can answer at this time. So thank you very much. I will stay on board for a few seconds just to keep talking and say thank you to everyone. Thank you to Mandy for all your work you're doing in the city of Burlington, to Levi, to Cindy, to Kim, to those individuals you're working with and those organizations you're working with across the country, to Stephanie and Mark, thank you. And of course, to Juliëtte, Dr. Sterkens, thank you so much for being our inspirational. We really, really appreciate everything you do. So thank you very much, everybody. Have a wonderful afternoon, and thank you for attending, and thank you for getting in the hearing.